Are you one of the millions of Americans who are suffering because of the high prices of prescription medications? Are you like millions who have to make the choices every day between buying food or basic necessities or buying your medications? Or do you go without your medications due to the high cost involved? Luckily, there is help available through something called patient assistance programs. I sat down with Brad Williams, our head patient advocate here at SCBN Prescription Advocacy, and we talked about patient assistance programs. And what I'd like you to do is watch this video and learn a little bit more about how you can get help with your prescription medication cost. Now tell me just a little bit about Select Care Benefits Network. Just assume that I'm someone who knows nothing about even patient assistance programs, or that help is available if you can't get free prescription, if you can't afford your medicines. Act like I know nothing and just tell me briefly, in 30 seconds or less, what Select Care Benefits Network does.
This is a patient advocacy company. In fact, we're the only full-service patient advocacy company in the country for patient assistance programs. Basically, we assist people get on the patient assistance programs to get their medications directly from the pharmaceutical companies for free or highly discounted rates. The companies make the drugs available for people that are on fixed incomes and lack prescription coverage, some of the neediest people in our society that need the most help. We basically assist them from point A to point Z, getting the drugs and basically staying on the programs, and we solve all the problems that pop up in the meantime to make sure they get what they need, the drugs they need for their lives.
Okay, so there's patient assistance programs. These are programs sponsored by the pharmaceutical companies?
Precisely, they are. These are programs that each individual company has, if they choose to have one, and they provide the medication. They have qualifications and guidelines, of course, but for the people that fall under them, they would provide that medication for free or high discounted rates. But there's a lot of hurdles to jump through. Some people can do these programs on their own. Unfortunately, we don't help those people. We help the people that cannot do these programs on their own. We want to assist people with issues like Alzheimer's. A lot of our patients are elderly. They're on Social Security retirement, Social Security disability. We help people who've had to leave work due to an injury, people that are on pain medications, many people who, even if they're not illiterate or completely illiterate, simply may be unable to take advantage of these programs. They can't understand the forms. They're not used to dealing with large companies across state lines that want paperwork to be handled for them and try to manage a renewal process.
So let's talk about the patient assistance programs. These are programs sponsored by pharmaceutical companies, and they give free, most of the time free, or discounted medications to people. And what people do they give those to? Just simply.
Simply put, about 43 million Americans who lack prescription coverage and who fall under certain income guidelines. They have to fall beneath a certain guideline of income to be eligible for these programs.
And is this a federal income guideline? Is it a standard throughout all the companies, or?
No, these programs are for people on a very fixed income. Basically, they don't have a ton of money and they don't have prescription coverage. So they're in a very, very difficult point.
So how do they determine, if it's a fixed income or if it's just a low income, or how do they determine which income, guidelines or whatever that would help people qualify to get free medicines?
You have to fall under very strict guidelines, in fact, and most of them are tied closer to the federal poverty level, being around 200%. Basically, you really have to not be making a very large amount of money to be on these programs. You have to be in a tight spot.
Okay, so these are for people who are in need.
Absolutely.
They don't have insurance. They are low income. The cost of prescription medications is astronomical these days. Many people just on these low incomes without insurance, either they get help like this or they can't afford their medicines.
Absolutely. They can't afford their medicines at all to begin with. Now on top of that, they're not getting their medications. So they can't afford them, they're not taking them, and they're sick on top of that. And they have nowhere to go. We're talking about literally 43 million Americans that are unable to take the medications that their doctors are prescribing to them for their health. This is a very terrible problem. And literally, though the programs are out there to assist them, these people are in a very tight spot.
Now, I know when we started our company a few years ago, about 5 years ago, the one thing that we would talk to people about, and we told them that help was available. Many people said, this sounds too good to be true. And the old saying is, if it sounds too good to be true, it probably is, right? And I remember a lot of our patients, felt that way. But since then, Montel Williams, as the spokesperson for the Partnership for Prescription Assistance, has done a lot to raise awareness of it. and I've noticed a lot of our patients now know that the programs exist, but they come to us anyway. Why would they do that?
Simple, because they can't handle the extensive processes that are out there. I mean, we're talking about 260 plus bureaucracies out there to deal with. And remember, patients come to us so they have one person, an expert, that can deal with these programs for them, handle them, dot their I's, cross their T's, and make sure the drugs show up on time. Make sure everything shows up on time so they get all the drugs that they need and they can take them when they require them. And the issues are, a lot of these people are scared to handle these programs, and some people simply can't handle them at all. They're in a position where they just don't understand what to do. And you're dealing with, if you dealt with one company, that might be easier, but some of these people have 6, 7, 8 plus medications. You're dealing with 8 different companies. That's a lot of work.
Now, how is that a lot of work? Patient assistance programs, they have applications. You got to fill out an application, send it in, you get your meds, right?
Not exactly. It's not quite that simple. First of all the companies founded their programs apart from each other. So every program is different. All their paperwork is different. Everything that they do is different. They all have problems differently. Their forms look different. They ask for different questions. They ask for different documents to come with the forms when they're provided. These companies send medications at different times, to different places, in different quantities. It makes the process far more complicated. If you break it down, it looks like a simple process until you realize you're dealing with so many people. The process is quite voluminous, and everyone handles things differently. It's unfortunate. It's a great thing. These drugs are available. It's a very good thing. However, indeed, there's a lot to do. There's a lot more that you don't see.
So explain it to me. Okay, I'm an average patient. I take 4 or 5 medications. I manage multiple diseases. And I find out patient assistance programs exist, and I want to do that. What steps would I have to go through? Someone told me in my ear, patient assistance programs exist, you can get your medications for free. What are all the steps I'm going to have to go through to get my medications for free, first of all, and to continue to get my medications on an ongoing basis? Could you just walk me through that?
I can. Remember, all the programs are different, so I'll walk you through how many of the basic ones operate. Most of them, you basically find out if you qualify, you prepare your paperwork, you have to go to your doctor, you require your doctor's signature on the prescription and of course the form, just like yourself. You'll need to prepare whatever income documents the company wants. Some will require your tax documents, such as your 1040, maybe a W-2. Many of them, however, will require like a Social Security letter if you're receiving Social Security retirement, pay stubs, pension statements, things of this nature. It just depends. Once you send this in, they judge whether to accept or deny you. And hopefully, you've sent in everything properly, in which case you can be accepted if you're under their guidelines. They'll send you the first med, and as most programs work, then you'll have to upkeep and follow every window of opportunity for when you can actually refill your meds until you reapply again.
Okay, so how do you do that? I mean, if you get approved, I mean, first of all, you know, the one thing that stood out to me is you glanced over it, you said, I gotta find the program.
Precisely.
First of all, how do I find the program? If I'm elderly, if I'm sick, if I'm homeless, I'm illiterate, or any of the numbers of things that people can be, you know, who are taking many meds and need the help the most. How do I even find it? Some people don't even have phones. But even if you do have a phone and you call the pharmaceutical company, I mean, you say you call Pfizer. I mean, most people don't know that their drug's made by Pfizer or Merck or AstraZeneca or whoever makes it. Most people don't even know who makes their drug, but let's say they knew that and they call this. They get through a big voicemail maze, they go through everything else, and how do they find the patient assistance program and get the right application sent to them?
It's a big problem. This is a very difficult issue. I mean, where do you go? The programs certainly don't send flyers to doctors' offices. They don't do that. You can hear about them through possibly PPRX. You can find them through the programs, through us, basically, to assist you in going through these programs. But to be honest, there's not a ton of outreach about these. Now granted, with 43 million people out there in this country that need this help, you'd think there'd be a lot more publicity about it. Sadly, there's not. There really isn't. There's not a lot of places people can go.